cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We're live, and we have David on the line. Good evening, David.
Good evening. I had a question. I have a woman I know. She's around 65. She had malignant melanoma on the scalp. That was removed. And at that time, also, they found in her head, they told her it was non-malignant, a tumor. I assume they call it a non-malignant, growth. I don't know what term they used to her. They told her it was a tumor, but wait 3 years. They checked it once, I think the next year, and then they told her wait another 3 years. First of all, do you recommend? Now they think there's another melanoma. The skin doctor said there's something on her leg. He thinks it's malignant melanoma again. Do you recommend PET scan to see if there's cancer anywhere in the body, or what type of diagnosis and what type of possible treatments would you recommend for a case like this?
Well, it sounds like she's got a couple different tumors. One is the melanoma, which is a cancerous tumor, and it sounds like she has one on the scalp and maybe another one on the leg. Now, if the one on the leg is a metastasis, meaning it's spread from the original cancer to the leg, that means it's a stage 4 cancer. She might have that, or she may just have a second primary melanoma. Melanoma is the most severe form of skin cancer. So I would really need to know more about her case and review the case in detail. And it's one of the cases where people should come in and close the door and spend some time. And then she's got, it sounds like, another tumor, which is a benign tumor in the brain, and that's probably a meningioma. Meningiomas are benign tumors generally, not always. About a few percent become malignant, like the worst form of brain cancer. So meningiomas can be treated. Our success rate in treating meningiomas non-invasively in the middle of the brain is 97%. So a very high success rate for meningiomas. Actually, for melanomas also we have a high success rate, but we'd have to know more about her case. And she's one where it's interesting to talk on the phone, but she really needs to come in so we can spend some time.
PET scan usually, do you recommend usually a PET scan to see if there's any other tumors anywhere in the body?
Well, PET scan is a good test for staging. Again, it'd be better first to understand if this tumor on her leg is a melanoma for sure, and if it's a new primary, which means a new cancer, or it's a spread from the other. If it's spread from the other cancer, that means it's stage 4. If it's a new cancer, then it may just be a stage 1 and can be easily treated. So PET scans look at the whole body, and I certainly am eager to do so in the proper case. But on the other hand, I don't recommend it for everyone because, number one, there is some radiation exposure to it. There's some cost to it, and not everyone needs every test. So the first thing that people need is good judgment, and that's why we see someone like her. So she's got a little bit of complexity that she has what sounds like at least one, maybe two melanomas and this third tumor, probable meningioma in the brain.
Now, the skin, the skin doctor she went to, he says he thinks it's another melanoma. He's sending her to somebody else to more, he wasn't completely sure. I don't know, or else he's just sending him to his partner to do another, I don't know what reason.
Well, if it's on the leg, I mean, the leg is not like a tumor on the tip of the nose, which was actually the next patient I was going to talk about. So usually a dermatologist would do it quickly, and a biopsy can be easily done and can confirm exactly what's going on. So I wouldn't recommend delaying what's going on. I'd recommend that she gets analyzed and worked up. And if she's getting a delay, give us a call tomorrow. I'll get you in tomorrow immediately and get you some answers and get you some care, because delaying melanoma is dangerous business. If it spreads, it can be a fatal disease.
The meningioma, the benign, usually the doctor said to wait with that. Usually,
well, we'd have to see the scan and compare the new and the old scan and see what's going on. Sometimes it's good to wait, and if it's growing rapidly, meningiomas are more common in women than men. They're probably related to estrogens. It's not known exactly, but the ratio is about 6-to-1 or 7-to-1 female to male. We were the first in New York to do radiosurgery for brain tumors and brain cancer, so we have a long experience over about 25 years. So we can talk to her about both when she comes in.
Okay, thank you very much.
All right, God bless you. We have a caller on the line. Good evening. Well, we just missed that caller, so if you want to call back, you're welcome to do so. I actually want to talk about a woman who came in this week from Massachusetts. She's a 45-year-old woman. She came in divorced, 2 children, a boyfriend, and she had a basal cell on the tip of her nose in Massachusetts at a hotshot hospital. They wanted to do Mohs surgery, which would have probably left a pretty big deformity on the tip of her nose. She's a beautiful woman, and she knows that when people see another person, the first thing they see is the face, and the first thing of the face they see is the nose. So she wanted to do everything she could do to avoid that deformity. And the beautiful thing about our method of treatment is, number 1, it's non-invasive. Number 2, it's highly successful. Number 3, most likely will leave her skin and her nose intact so that she won't have that kind of deformity. We treat a lot of skin cancers, especially around the eyes, ears, nose, cheeks, mouth. Obviously, we can treat them anywhere in the body. Last summer, we had a patient who was put on hospice because of skin cancers. A dermatologist who I've known for 20 years met that person at a hospice facility and said, "Why don't you call Dr. Lederman?" We treated the woman with 5 treatments, and she's off of hospice. So, wow, what a difference a day makes. For this woman from Massachusetts, she met us. She canceled the Mohs, and she's arranging to get some radiation. She'd like to get fancy radiation with us to try to avoid that surgery and the deformity and the skin flaps and other issues. So if you have a skin cancer, give us a call. If you don't have a skin cancer, and everybody, cover up. The sun is showing more intensely. For many women can buy skin lotions and creams. Actually, some of their makeup has skin sun protection in it. Put that on, whether you're a man or a woman, put that on your face, your hands, cover up. Try to avoid the midday sun, the direct sun, especially if you're fair complected, like Irish or Northern European. There's a great amount of skin cancers, almost an epidemic of skin cancers in Americans and other countries where there's a lot of fair-complected people getting sun exposure. So a lot of the skin cancers can be avoided. So sun protection, if you have a skin cancer, give us a call. We try to give treatment that avoids the deformity of other methods of surgery. We do non-invasive treatment, no cutting, no bleeding, and most likely you're going to like our results. We take a lot of difficult cases and seem to be able to turn the corner. When a woman, speaking of difficult cases, this is a woman who's 39 years old. She at age 31 had a stage 1 breast cancer. She chose to have a mastectomy at a big hospital. Actually, she chose to have bilateral mastectomies, which we would not recommend. It was done at a big hospital. We did not have the chance to see her when she was 31. And now she has metastatic cancer, actually had metastasis to the brain, which we treated with focused treatment. And she came in this week. She just spent a week in Florida, and she's told me she's so tired. She is so tired. She can't stay awake. She saw all her doctors at the big hospital. We zeroed in, ordered one test, got a calcium. It was high. We got her treated, and she's the happiest woman in the world. She saw all the other doctors. Everyone missed the diagnosis. We made the diagnosis. She's back to her old self, feeling great, happy, and healthy. And that's where we want all of you to be, happy, healthy, and content with your medical care. If you have questions, give us a call at 212-CHOICES. Thank you for listening, and God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas